Hi, I'm Amy Lawyer. I'm the Equine Extension Associate at the University of Kentucky. I've been around horses since I was about 5 years old, mostly trail riding and some showing, and then as I got older it was in more of a professional capacity, working at breeding farms, at racetracks, at vet clinics. I've worked on cattle farms via horseback, and then as it progressed, now I'm into more academics, teaching about horse science in extension and university settings. No, I haven't. I'll admit, when I was younger, and especially trail riding, when we weren't showing, I didn't wear a helmet. It kind of wasn't the norm, but the older I've gotten and the more I'm aware of the risks and possible injuries that could result, I will say that now I do wear a helmet every time I ride. I had gone to close the gate behind the person while they were in the arena riding, and I was standing behind the gate and looking down at the ground, because where I was at the gate was wrapped in plastic so that the horses could hopefully see it better and know to not run through it, was the intent. But it also meant that I couldn't see into the arena. I wasn't tall enough to see over the gate. So I was standing behind the gate waiting for the person to finish their run. I was looking at the ground, so my head was down, and didn't realize that the girl had lost control of her horse. The horse was going full speed. She wasn't able to stop it, and the horse ended up crashing into the gate. I was standing about arm's length away from it, looking down, so the post of the gate hit me right on top of the head and sent me flying backwards right after that, and ended up suffering pretty severe soft tissue injuries and concussion from that. Fortunately, there was no bone fractures. I don't think it was necessarily a preventable injury. Sometimes around horses there's freak accidents. I will say that there are some things that could have made me more aware or in a better position to get out of the way, maybe. For example, every year since then I've been at the show, we still wrap the gates in plastic. I go and cut a small hole, so if anybody's shorter than the gate, you can see through it to see where the people are. I'd say that, just being more aware of the surroundings and being more aware that, something could always happen, even if you're not expecting it, probably would have helped, but the situation itself was probably unpreventable. My symptoms included migraines, neck pain, light sensitivity, nausea, dizziness. I had balance issues for a long time afterwards, really up to 6 months afterwards. I had personality changes. I was a lot more, the irritability added to that, but it took a while to get over that, and then to this day I still have headaches that reoccur from that and neck pain. I'm a lot more aware of the potential for the unexpected. I think that most people are kind of aware of the obvious things to be worried about, being kicked by a horse or something, but I think this has made me much more aware that something that you're not even seeing could happen. So just be aware of your surroundings, be aware of other people that might lose control of their horse. I think the moral of the story is that most of the time horses are fairly safe, otherwise we wouldn't be able to be around them all the time. But that doesn't mean that you shouldn't always be aware. You shouldn't assume that other people are always in control of their horses, so you have to be responsible for yourself and aware of what's going on.
My name is Dr. Dan Hahn. I'm Associate Professor of Neurology, Neurosurgery, and Physical Medicine and Rehab. A concussion is a clinical syndrome as a part of traumatic brain injury spectrum, usually considered to be mild. But mild is a misnomer because mild could range from having very little symptoms to significant amount of symptoms for quite a long time, quite a long period of time. Symptoms can last up to 24 to 72 hours to up to weeks to sometimes even months. The CDC estimates that there are approximately 1.7 million traumatic brain injuries a year. And of that 1.7 million, approximately 1.3 million are concussions. And it's a recently discovered fact that of the concussions, approximately 15% of those concussions are equine sports related. And of all the traumatic brain injuries altogether, approximately 45% of the sports related traumatic brain injuries are equine sports related. Clinical symptoms of concussion can vary quite drastically. However, some of the most known symptoms include changes in short-term memory, attention, processing speed, and other cognitive changes, changes in personality, irritability, depression, anxiety, mood changes, and headaches. And some of the other notable changes can also occur with nausea and sensitivity to light and noise. At Saddle Up Safely, a committee got together representing all different fields involving equine sports, including healthcare. Came up with an app for quick and easy access of clinical symptom checklists so that concussion assessment by anybody who is experiencing symptoms, who's fallen off a horse, who's been struck by a horse, can go over the symptoms quickly and with easy access so that they could have a plan of action for subsequent follow-up. As the symptoms of concussions can vary widely, it's very important to know what kind of symptoms that you're looking at. It could also include neck pain, cervical types of headache, can be different from the migraines that can occur from concussions as well. So it's very important to follow these symptoms up with a healthcare provider. When in doubt, it's always important to visit your emergency room and follow up with a physician from the emergency room. It's important to note that in equestrian sports, helmets lead to an absolute risk reduction of head injury by up to 50%. So it's incredibly important to always wear your helmet.